And now I will continue in English. Our next speaker comes from Sweden. His name is Dr. Mats Reimer. He is a pediatrician in Sweden. And about half a year ago, we got the news that the law in Sweden was different according to our law when it comes to treating children with alternative treatments. So we invited Dr. Mats Reimer to give a presentation on his subject. And in Sweden, he is known as the sharpest pen in Sweden when it comes to alternative medicine. So, Dr. Mats Reimer, the floor is yours.
Thank you very much for having me. Thank you, Catherine, for inviting me, and thank you, Lukas, for housing me and my family. I'm going to talk a little about who I am. Then I'm going to talk about my subject, the anti-quackery law in Sweden. And I will finish up with some example where Swedish children are exposed to quackery in spite of the law. And if there would be any time left, I could talk a short while about differences between Sweden and Norway, because my wife is Norwegian, and in Norway there is a bit more quackery than in Sweden. This is where I work. I work as a general pediatrician outside Gothenburg, just east of Gothenburg, where the airport is. And me and my colleagues, we fill a gap between the hospital, the children's hospital, and the family doctors, the GPs. This is what I work with. It's mainly diseases beginning with A: allergy, atopic dermatitis, asthma, autism, ADHD, and fat children. And when we are finished with A, we start with bedwetting and Borrelia, and then we go on. And I have worked here for 18 years. These are a few more pictures of my job. And my first patients, they are now adults, parents, and come to me with their children, which is very nice with the continuity, but it makes me feel a bit old. So I am old. I am actually the same age as the anti-quackery law. I'm born in 1960. And this law was proposed after a public inquiry, an investigation called the Kwakzalverij-utredningen, which was presented to the government in 1956. And by then, there were around 300 homeopaths in Sweden. And I think there are less now. And there were about 50 each of traditional healers and chiropractors. And that has changed, so now we have a couple of hundred chiropractors. And the essence of the law is this, that it's only authorized medical personnel who have education, training, and license who may diagnose or treat the notifiable contagious diseases, which is serious infections. And then they have specified 3 diagnoses: cancer, diabetes, epilepsy, and also complications of pregnancy and childbirth. And then the last sentence, children under a certain age. And this age limit became the subject of a political discussion. From the start, the proposal was that you should draw the limit to infants. Infants should not be exposed to quackery, to diagnosing or treatment by non-medical personnel. But the medical board suggested 18 years, that all children should be protected. And the parliament decided to draw the line in between. So in Sweden, the age limit is 8 years. So if you're under 8 years, only authorized medical personnel can diagnose or treat your child. And the reason for choosing 8 years was that the kids start school at around 7, and then they will have supervision by school nurse, and they can see the school doctor. So there will be some proper supervision of their health. So that's the reason for the 8-year age limit. This law is old, so the law from 1960 is no longer in effect. But we have a new law called the Patient Safety Law from 2010, and they have incorporated this piece of text in the same manner in the new law, so it is still in effect. There has been some political pressure to change this, pressure from both sides. So the Society of Psychologists and also some, quite a few members of parliament who are physicians themselves have been arguing for that psychiatric diseases should be included in this law, that there should be protected against quackery if you have depression, anxiety, or even more serious psychiatric diseases. And to me at least, it seems a bit illogical that you should be protected from quackery if you have diabetes, but not if you have another endocrine disease, hypothyroidism or Addison disease. And why is the only neurological disease protected? Epilepsy, why not Parkinson, MS, ALS? On the other hand, we have our opponents, the so-called lobby group, who is calling for an abolition of the age limit. And this is their website. It's a lobby group against the quackery law. And they call it Hela Barn, which can translate into healing children or into whole children. It means both things. And they have been a little bit successful in one thing. They have been petitioning the UN Committee on the Rights of the Child. So a few years back, in 2009, the Swedish government got a letter from this UN commission noting that access to complementary alternative medicine is recognized in Europe and the rest of the world. How can Sweden deny this to children? So this is what the government received. The committee recommends that Sweden considers reviewing and amending existing legislation to ensure that all children without distinction of age have access to CAM and can enjoy the right to the highest attainable standard of health. So it's a bit shocking. The government didn't care about this. They will not change the age limit. The law limits the amount of quackery we have in Sweden, even if it's very, very rare to have anybody prosecuted according to this law. But I don't know if you have realized already, but there's a loophole in the law. It only protects children from quackery from non-medical personnel. The law does not protect children from being exposed to quackery delivered by medical personnel. Very few doctors in Sweden use alternative medicine. And if they do not do it openly. And there is actually only one big exception that I know of, and this is the Anthroposophic Hospital, quite close to Stockholm, in Järna, where they use homeopathic preparation and other anthroposophic medications. And I don't think that treatments are very harmful, but to children at least, I think it's their stance against vaccination that might be more harmful. The anthroposophic argument against vaccination is different from other anti-vax. It's not that vaccination is unnatural, it's that the anthroposophic religion, they want the children to get sick. They want the children to get fever from the infectious diseases in the first 7 years to make the soul fit into the body. The reincarnated soul must fit into the body, and the heat of the infection is important for this. So they have a very specific religious reason, but they rarely talk about it outside their group. But this is, at least to me, the true reason why anthroposophy do not want to vaccinate the small children because they seem less reluctant to vaccinate older children, actually. And since they don't vaccinate very much, they have epidemics. We have, in the last few years, have a few outbreaks of both measles and rubella around Järna. In your program, there is a reference to another homeopathic case, which is actually not really connected to this anti-quackery law, but I can say a few words about it. A few years ago, the medical authorities lost a court case against a medical doctor who prescribed a lot of homeopathy. And they lost the court case, not because the court thought that homeopathy was effective or okay to give, but because the punishment that the medical board had given him was very, very harsh when no individual patient could be proven to have been at risk or at harm. So it was more a technical point that he got free on. So the homeopaths think this is a great victory, but I don't think that's true. I think the medical board will not change its mind. If I should start prescribing homeopathy, I would be in trouble, I think. So, but Swedish doctors don't use much alternative medicine, and I was quite shocked to hear that 39% of Dutch pediatricians use alternative medicine. That was really astonishing. The group that is most pro-quackery would be the chiropractors. And in Sweden, the chiropractors and the naprapaths are licensed. The osteopaths and the zone therapeutic people, the reflexologists can't be licensed, but the chiropractors and the naprapaths can be. They can get their education or their training in Sweden or in the US or in Britain or in Denmark. So we have a private chiropractic school, and they have been trying very hard to get in to be affiliated with some university in Sweden. But so far no success, and no medical faculty wants to accept this chiropractic school, and that I think is very good. And as I think you know, the problem with chiropractors for the pediatric patients is twofold. One is that they claim that they can treat pediatric conditions like infantile colic or bedwetting or recurrent ear infections. And the other problem is about safety, that this maneuver, manipulating the neck, I think can be hazardous. Then we have the acupuncturists. And acupuncture is, to me at least, a placebo treatment that was too hastily accepted into mainstream medicine. And once we got it in, it's hard to get it out again. It's mainly used in Sweden by physiotherapists, a few nurses, a few doctors, and not so much in children. But we have a few nurses who like to treat children who have infantile colic, babies who cry a lot, with acupuncture, and then they stick a needle in the thumb grip for just a few seconds. And it works. I think it has a very powerful placebo effect on the parents. And since we doctors don't have much treatment to offer, our treatments also consists a lot of the placebo effect. I don't think it's harmful, at least. So as I told you, it's very seldom that quacks are brought to trial. But I can tell you briefly about one case where a quack actually was brought to trial. It was in 2010 in a town close to Gothenburg. He was a self-proclaimed Ayurvedic doctor. I don't think he actually had any training in Ayurveda. And he was convicted or charged with 10 cases of fraud because he told people they were sick and took their money, and 5 cases of sexual molestation because of his treatment. They consisted, among other things, about it was oil massage of the female patient's breasts and genitals. For this, he got 3.5 years in prison. But had he only been tried by the Quackery law, he would have got 1 year in prison maximum, because that's the maximum penalty according to the anti-Quackery law. There was for technical reasons, he was not charged with a more serious crime. He treated a woman suffering from cancer He gave her cabbage, basil, and mussel oil as treatment and charged her 5,000 euros. Of course, she died from her cancer. But for technical reasons, he was not tried for this crime. So Swedish children, they are at not a great risk for dangerous quack treatments. The only risk for the Swedish children, I think, that they might, in some cases, receive a substandard care, substandard health care. For example, not given vitamin K when they're born, or not being fully vaccinated, or not being given the best medications we have for real diseases like eczema or allergy or asthma. Maybe they're put on unnecessary diets, and they can become socially isolated if somebody gives a quack diagnosis of, for example, electrohypersensitivity, which we have a few sad cases, and I have unfortunately one patient who got this diagnosis and was prohibited from going to school as long as they had Wi-Fi in the school. I will finish off by some examples of quackery, which is more of a media problem, or a problem in the press. This is a patient organization, a parents organization. It says treat autism now. And if you have a child with this serious disability, autism, it's very hard for some parents to accept the diagnosis and accept that there is very hard to do something about it. You can use behavioral methods to ameliorate, you can change the environment to make it autism friendly, you can try to have a low effective approach to the child. But for many parents this is not enough. They want a cure, they want a true biomedical treatment. And this parents organization, they fight for biomedical treatment. And the three usual treatments they use, quack treatments, are that they put their kids on diet, which can be dangerous, as you heard, removing milk and gluten and soy from the diet. They use very high doses of different supplements, which in some cases can be harmful. And they sometimes use this hyperbaric oxygen therapy, putting the kids in the tank once in a while. Then we have the anti-vaccination movement, and they have some very good or nice-looking websites. Here is one of their arguments. They're trying to link narcolepsy to nodding disease. And the truth behind this is that narcolepsy might be caused by vaccination. I don't know if you've heard this in Holland, but in Sweden we have had a couple of hundred kids who got sick from the pandemic influenza vaccine. And it's a true medical disaster. It's an autoimmune disease, and it only hits some children, maybe 1 in 10,000, 1 in 5,000. So it was not expected, but it's true. But here they're trying to link this real problem with another neurological disease, and trying to pin it on the polio vaccination. In Eastern Africa, they have a neurological disease called nodding disease, which affects children, and it's probably caused by an infestation with a microfilaria. And the last example of quack problems for children is that we have a strong group warning us against Wi-Fi and mobile phones, putting out advertisements like this. Anton's parents doesn't know that the mobile phone can cause a brain tumor. So that was my presentation. In my spare time, I blog more than my wife wants me to. The blog is in Swedish, but maybe you can use Google Translate if you want to read my blog. Thank you.
Well, thank you very much for this very nice presentation. Of course, we had high hopes that the Swedish law would be a solution for the problems we face in the Netherlands, but that's not quite the case. And I think you and I have lots of work to be done in the future when it comes to fighting quackery. Who wants to ask the first question? No questions. Everybody is totally... Gert-Jan, please use the microphone.
You made me curious about the situation in Norway. You promised at the beginning of your lecture that you could tell us something about how Norway differs from Sweden. And I'm rather curious because I visit Norway at least once a year, so I want to get the Norwegians better.
Okay, I can do that. If I say something that's untrue, my wife, who is Norwegian, will probably stop me. The alternative medicine people in Sweden, they look to Norway and they try to petition the politicians that Sweden should become more like Norway. In Norway, alternative treatments and healers have a much stronger position in society. A good example is a nice old man, a traditional healer, a Christian healer called Snåsamannen. He has connection with the royal family. There was a book written about his life and work, which was a bestseller in Norway. And he was thanked by the bishop in Norway's most famous cathedral in Trondheim. And the cathedral was packed with people who wanted to see this old, nice healer. And when some nasty skeptics raised questions about if he really was a true healer, if he could heal anything, people were outraged. And one of the persons who stood up for the healer was the Minister of Health, because he had personal experience. He could tell the press that his son had had colic, crying and crying and crying, and he didn't know what to do, the Minister of Health. So he called the healer on the phone, Snåsamannen, and it helped. And this could not happen in Sweden. The Swedish Minister of Health would never endorse a healer. Norway has also made some policy changes and legislation that the CAM people in Sweden want. Norway has a publicly funded research institution in the far northern university in Tromsø, where they do research in some way into alternative medicine in a positive way. They want to find out how it works, and they have enlisted, for example, homeopaths to do their PhD there in this university. They have also made an official website where the public can go to learn facts about alternative treatments. And this website is completely uncritical. It is not, it's more like an advertisement for the different quack treatments. And finally, they have an official registry for alternative practitioners. That if you belong to a society of healers, or a society of homeopaths, or a society of massage therapists, you can become an official therapist by enlisting. And it's a very, very low standard that you have to have such and such education, a year or two maybe, and you have to know something about the laws and have some ethical legislation. But very, very low standard. And so in that way, Norway has endorsed the alternative medicine in a way that Sweden still has not. So those are a couple of differences between Sweden and Norway.
Okay, thank you. Any other questions? Yes.
Can you see much difference between Sweden and Norway in deaths or handicapped people through alternative medicine when it is so common? are there many more negative results in Norway?
I didn't quite get that.
The question is, are there in Norway more complications and bad results because of the higher popularity of alternative medicine in Norway compared to Sweden?
No, and one reason why I don't think there is the persons, they have looked into it more scientifically. Who goes to a healer? Who goes to an alternative practitioner of any kind in Norway? It's usually females. It's more females than men. But it's also that the person, the customer of the alternative praxis, they are usually more educated than the rest of society. They are middle class, they have a good income, and they go to the healer and they go to the ordinary doctor. So they consume alternative care, but they also consume more school medicine, orthodox medicine. So it's more like an add-on thing. It's not that they use it instead of getting the operation or instead of getting the insulin.
So do we see more health benefits from this add-on extra alternative?
I think Swedish people, they live half a year longer than Norwegians.
There you've got it.
Close.
Kees Renkens has a question.
I have a question about the status of the chiropractors in your country. In the Netherlands, they're not recognized. We don't recognize their diplomas, and they're fully concerned as being alternative. Is that the same in your country? And how is the position regarding to healthcare insurances with these chiropractors? In Holland, they are campaigning. They try to get more recognition and reimbursement and so on.
It's a mixed bag. The chiropractors, they had been lobbying for getting recognition with a license for a long time, and they finally petitioned the politicians to grant them this, even if the medical board and many other people were against it. And this was 20 years ago, I think. So they have this possibility of becoming licensed, and that means that there is some supervision from the medical board, that if I believe that a chiropractor is doing quackery, I can report him to the medical board. And I have reported a bunch of chiropractors for what they said they were doing according to their websites. And since I started doing that, at least their websites have changed. I don't know if their praxis have changed, but what they advertise to the public on the internet, that had changed. And I wouldn't be able to do that if they were not licensed and therefore under the medical board's supervision. Still, they have not been accepted into orthodox medicine in a way that there's no officially public-funded schooling for chiropractors. And they have been trying very hard to get into or being affiliated with any of the universities in Sweden, but as far as I know, they have not succeeded. And at least they will not be accepted by any medical faculty. I think there might be a risk that some university without a medical faculty will accept them. But so far it hasn't happened. And they are never employed in the public-funded system, and the patient have to pay with their own money. And actually I think that it seems like the chiropractors are two kinds. There are some good guys, and I know a few, who are more like physiotherapists, and they treat mainly back problems and other musculoskeletal problems. And then you have the real quacks who believe that they can treat almost anything by cracking the spine.
Okay, last question. Nobody wants to ask a last question? Yes, there's a question over there.
Hello. My question I had in mind for some time. You mentioned something in your answer on the last question. My question is, who pays for this quackery in Sweden, both from the non-licensed and from the licensed physicians? And how do you think that if they're paid from the health insurance or by the persons themselves, how do you think that affects the status and the public opinion of quackery?
The only public funded quackery you would find would be maybe the physiotherapists using acupuncture and a few other methods, and these anthroposophic doctors who use anthroposophic medicine because they are publicly funded, even if I'm fighting against it. If you go to a chiropractor or a naprapat, you have to pay with your own money, and the public health insurance will not pay for it, and I doubt whether the private insurance would pay for it either. I think that the alternative medicine in Sweden is it's a fringe thing. I think it's much more common here, even if I think it's even more common in Germany and France. And maybe the law has something to do with it, setting the standard. And all the alternative practitioners, they know about the law. They know what they cannot at least say in public. So if they do treat young children or patients with cancer or epilepsy, they will never tell it outside. And the patient will know that he cannot speak about it because he will get the therapist into trouble. So I think that the law has had an effect of limiting the extent that they have alternative medicine in Sweden.
Thank you.
Okay, and with this I want to thank you for a wonderful presentation.